the suture removal.
Thank you.
Myself.
Samuel, please dial extension 203. Samuel, please dial extension.
My grandparents moved to Miami from Cheyenne, Wyoming in 1923, and they bought a farm. My grandfather, A.T. Knowles, Adam Taylor Knowles, was a veterinarian and a medical doctor, so he was a DVM and an MD. They converted a barn to the first veterinary clinic of Knowles Animal Clinic. And they lived in the house on the farm. Eventually, they tore the barn down and built a rather regular veterinary clinic. And when my father became old enough to go to college, my grandfather said the only way he would send him to college is if he became a veterinarian. So he did. And when my father came back from college, he married my mother, and they built a second story on the veterinary clinic. That's where they lived, in an apartment above the clinic. In 1956, my father and his brother, who also was a veterinarian, opened another clinic just down the road from where we are now. And they were together until 1963. At that point, they broke up, and they also both had their own clinics. My father moved over here and built this clinic in 1963. In 1971, I met my husband and we got married, and he also is a veterinarian. And we went to New York for a year and a half for an internship, and at that point, when we were coming back, he wanted to move to Miami. And we came down here in 1973, and then in 1974, my husband and I, David and I, opened a Snapper Creek. It was just a little shopping center. Then in 1975, we opened up Snapper Creek, the building that it's in today. Dr. Block applied for the job, and he came down here from Illinois. And then they became friends and eventually partners, and now they own the practices together. And it's been a really great relationship for both of them. And since then, Dr. Block has been down there running that practice. We are the oldest single-family owned veterinary practice, as far as I know, anywhere, but at least in South Florida. We've been around since 1923, so that's 91 years. And we're very proud of that.
Heart radiation for sure.
Okay, I'll take it.
I love the pets. I love seeing the connection between the pets and the owners, and that's the best part for me.
The one thing people really need to know about Knowles is that we are open 24 hours, but we're fully staffed 24 hours. We don't just have a technician here overnight or one person answering the phones. We're fully staffed. The doctor's here all night. The doctor's watching your hospitalized pet all night. There's at least 2 technicians here all night. It's not just a 24-hour, let's call and get a doctor in. There's somebody here all the time.
We treat them as if they were our own.
We offer services that other clinics are unable to.
The experience that some of our doctors have. Dr. Wise with his orthopedic surgery.
Marley, who is a spayed female, 6-year-old, 67-pound dog who hurt her knee in April of this year. Typically what you see is you go to the park and you throw the ball and the dog goes tearing after the ball and goes past the ball, and you see them make those quick turns and they turn and try to come back, and what they do, they plant the foot and twist it, and when they twist it, what they've done, they've taken that thing and they've popped it, just like that, and it's a one-shot deal. They stomp and they turn and they pop, and then they scream and they pick the leg up. And it's one, you go outside and your dog is fine, you come back in, your dog's lame. The vast majority of the time in a dog that's in the middle age is neutered and or spayed, is they've torn that cruciate ligament. Typically what happens is they hurt the leg and they're lame for a few days and they get a little bit better, and then over the next few weeks to months they get progressively more lame, and that's exactly what Marley did. Is with this particular procedure is we try to take the angle that the dog is naturally down to a 5 to 7 degree angle. By doing that, you eliminate the need for the cruciate ligament. And the cruciate ligament in a dog it has 2 bands. It has the cranial band and the caudal band. The cranial band prevents the knee from the femur from sliding backwards on the tibia, and it slides down. The caudal band keeps the knee from turning in when he walks. So if you have a complete tear, the femur tends to slide back and turn in. And so that's what a dog does. You see them walk like that, and every time they walk, it pinches the cartilage and causes pain. So you'll see them walk, they'll bend their knee, and they tend to keep it bent so that they don't have that slipping when they do walk. The way it looks on a model is if you do this, every time a dog takes a step, that slides forward, and when you get to this point right here, it's painful. And so the way the TPLO works is, this is about a 25-degree angle on this model, and so you take that 25-degree angle and you take it down to what the 5 to 7 degrees, and it won't move. So what you've done in essence is you've removed the need for the cruciate ligament.
I'm here today with Marley. She had her TPLO surgery about 2 weeks ago, and she's doing terrific.
Marley came back in for her 2-week recheck today, and she's doing extremely well. She's walking almost normally now. There's a little bit of a limp at about the 1 month point after 2 weeks, which is a really good recovery so far. She's pain-free, and she's doing all the things you want her to do. So the recovery that she's going to have should be excellent, and she should get better and better as time goes on. We'll do 2 more x-rays 2 weeks apart to see that the bone is completely healed before we let her have total freedom from the leash. But so far everything is right on schedule, actually ahead of schedule, and we're thrilled to death, and the owner's thrilled to death with her progress so far.
I started at Snapper Creek in 1987. In 88, we then became a 24-hour animal clinic. Now we have a doctor on staff 24 hours a day, 7 days a week, with a full staff with that doctor. Surgical technicians, we do surgery at night, we take care of the critical patients all night long. We are also a referral clinic, so when other clinics in the area close, our veterinarians are there to take care of their patients and then send them back to their hospital in the morning.
Yeah, hi, this is Jim Block, Dr. Block at Knowles Snapper Creek. Is Bob available?
Dr. Block's forte is diagnostic medicine.
And he stays up to date on the newest things that are out there and make sure that the clinic stays up to date. But he really likes talking to the clients, and the clients love him.
Yeah.
I mean, he's charismatic, and
Dr. Block's very charismatic.
Jim Block.
Yes.
Nice to meet you, sir.
We see a number of the canines, the working canines, law enforcement from all the different agencies in town and in the county and the city. And we today we saw this dog owned by one of the local law enforcement agencies. This dog was in this routine checkup, doing very well. He's 12 years of age and still working. This German Shepherd, which is really quite remarkable for those guys. He's a bomb detection dog. He had done, I think, more apprehension work when he was younger, and they retrained him. He's in really fine shape, good attitude, does very well, healthy sound dog.
One of the things I learned about Dr. Wise is the incredible orthopedic work he does. And not only with cats and dogs, but with dolphins, which, is pretty amazing.
Okay, on 2 different occasions we were involved with dolphins that had broken their jaws, broken their lower jaw. One time, a friend of mine was a veterinarian, and he called me into the case, and we went over and looked at it, and we did it, took the crew from here, and we were able to get an external fixator on the jaw. We left it on there for 3 months. The dolphin did very well. We took the external fixator off. 3 months after we put it on, the jaw was completely healed. And from that point forward, the dolphin did just fine. In the second occasion, we were called in again on a different dolphin. Same scenario, it hurt itself and ran into a piling and broke the lower jaw. And we fixed that one the same way with an external fixator that we left on for 3 months. That dolphin is doing extremely well. He's eating, he's healthy, he's maintained his weight. That was sort of one of the little side bars that you get to do that's a fun thing to do, and it helped something that you're not used to helping. So the way we did it, decided we'd just treat it like a collie. And since they have long lower jaws, and we'd fix that the way we would have fixed a collie. In both cases, it worked out really well. A couple of times we worked on mountain lion cubs and that sort of thing, but vast majority of the time it's been dogs and cats. But when you do get to do something like that, it's interesting and it's nice, and it's good that you can help something that otherwise would have starved to death because they can't eat with a broken jaw. To me, that was very rewarding because it was interesting and it was different, and they both did very well.
We have started a charitable fund, which we have started with the Miami Foundation to actually help the medical needs of retired law enforcement dogs.
It's a huge issue because some of our guys have 2 retired dogs at home, and by the time they retire, they're in their teens and they're suffering.
That's when they have the
some
problems,
issues.
and they've
Yeah.
taken such a beating. I talked to corrections yesterday. There's a dog that probably needs to be retired because he can't do the jumping anymore and do the work that he has to do. And so if they get into a serious medical problem and it gets expensive, then that's what this fund is going to be for.
That's fantastic. That's fantastic.
When these dogs are retired, the police officer who usually handles these dogs, has been their handler and their mate and their partner really for sometimes many, many, many years, usually adopts them, but then their care, which has been often underwritten by whatever municipality or agency they work for, disappears. There are no stipends, there's no pension, there's no retirement money, whatever you want to call it. And a lot of these folks can't, when some of these dogs get sick as they get older, need some assistance, and that's what we've set this fund up for. We're starting out with funding for South Florida dogs at this point, and hopefully it'll grow to a bigger project than that.
The medicine practice here is very up to date. We try to educate our clients as to, what their patients have by giving them information more specific to every case.
It's really effective. I've been to several clinics and I volunteered. I actually graduated from Miami-Dade as a veterinary technician, and I've had several experiences at different emergency clinics as well. This is one of the places where I've seen they actually go through thoroughly and try to find the right diagnosis by discounting little by little what's wrong with the pet. So it's really, really effective, and they really do it in a systematic way that, gives good results.
Pee-wee presented to us on emergency just a short while ago. He ended up being in the sun for about 2 hours. When they saw him, he was just laying down, panting really hard, and definitely warm to the touch when they went to him. So they actually hosed him down with some water to try to cool him down, but seeing that he wasn't really responding all that much, they went ahead and brought him over here.
I would like for people to know that if they were to bring their animal here, they'll be taken care of 100%.
I had a bulldog that came in. The history was 2 weeks of tearing from the left eye. The owner said that the dog was rough playing with one of the siblings, and that possibly one had swiped the other in the face with the paws.
I think what sets Knowles Animal Clinic apart from other veterinarians is our commitment to teamwork and patient care.
We really do care. We really do care about the pets. We become really attached to them. The boarders, the hospital cases, we become invested as much, as people come in here and we see what's going on with them. We do relate to them and we understand because we all have pets here too.
Guys, second time. I need a guy. Come on. Guys, we have a large emergency. Tell him it's a seizure. I have a seizure.
I feel very good about the medicine that is practiced here. It's very thorough, very precise. Great care goes into providing each animal with the services that they need, the medical attention. Our doctors, our technicians, our support staff all always go 110% into making sure that the animals are taken care of.
Knowles does the best medicine. I've worked at other places. They don't do bad medicine, but it's very thorough. The doctors are very educated. There's a network of doctors that they all consult. The medicine is state of the art. We're up to date on medicine. The doctors stay up to date with CEs and they like what they're doing.
They're up to date. They're well informed. They try different stuff. Like we have a doctor that does acupuncture as well as holistic medicine.
We do 3 different types of acupuncture: dry needle, electrical, and aqua acupuncture. It's a great extra modality to have for our geriatric patients who have arthritis. It's a nice extra tool to have. And this is the aqua acupuncture, which I'm going to do at right gallbladder 29. And this is to simulate an acupuncture point for a longer period of time once the patient walks out the door. Very nice. then.
Dr. Wise would make it a family environment because he's just the most lovable guy.
Every small child, girl and boy, wants to be a veterinarian. So when they come in here with their parents, a lot of times they will say, when I grow up, I want to be a veterinarian. And what we tell them is that when you're 16, you can come in here and volunteer, and you can follow us around, and we'll show you the good, the bad, and the ugly. And we tell the parents the same thing. If they want to be a veterinarian, they have to see there's a good side to this, there's a heartwarming side to this, there's a heartbreaking side to this. So there's a lot of ups and downs. You can get as high as you can get, and you can get as low as you can get being a veterinarian just by the things that you deal with. In my career, between 60 and 75 kids who have gone on to be veterinarians that volunteered here. That's one of the most rewarding things, because you take somebody who thinks they want to be a veterinarian, it's a dream they've had, and then you show them what it's like, and if they still want to do it, you know, we encourage them and we show them what we can and teach them as much as we can. And then when they go to school, most of them come back here while they're in vet school and they work with us in the summer times and during breaks. And it's sort of interesting to watch them go from a high school kid to a college kid to a veterinary student, and keep that love of the profession and watch them develop and watch them do what they want to do and see the joy in their eyes. And when you're lucky, you get one that really likes it and likes Miami, and that's how we got Dr. Abraham, which is one of the best things we've ever had, because she came here while she was in Florida, and then she came back and has been with us for the last year and a half. And so those are the kind of things that really, once you established yourself and you're sort of far along in your career, those are the kind of things that really make it worthwhile, because you're sort of getting the next generation ready, trying to pass on what you know to them and just watch them develop. And that's, to me, at this point in my career, that is the most rewarding thing that I do, not besides the animals, of course. It's too bad at the end of my career I can't just pick one of them out and download 40 years of experience into them, but you know, the only way you can do it is just one case at a time, one idea at a time, and just tell them things, and show them things in the room when you see them, that little subtle things that will help them be better than somebody that didn't get that opportunity. So that, to me, that's what keeps me going at this stage.
Knowles Animal Clinic is working towards a future of continued exceptional medicine. We're starting a non-profit organization called Knowles Animal Clinic Save a Life, which will help those animals with a curable disease or injury and have no owner to get the medical attention they need and be placed in a loving home. The Knowles family is extremely dedicated to all aspects of veterinary excellence, and will continue doing that into the next generation.